Historically, in our webinars, we were using two kinds of dolls, right? So this doll and this doll, they must be already familiar to you. And what is the central message? So this doll is the doll which has the right kind of the pelvic structure, right? So you see, this is the doll which has the rotational mobility of the leg under the pelvis. So this is the total ring of the pelvis which is available within her. So that's a very big and important point. Now, as we look at the hip joints, what do we see? Each of your legs, you can stand up and try. You should be able to turn your foot all the way in and then take your foot and rotate it all the way out. So in total, between traveling from the position of all the way out to all the way in, you get 180 degrees, right? And then as you travel from the position which is all the way in to the all the way out, that's another 180 degrees, right? So together, that's a half circle and that's a half circle, right? You put them together, full circle, yes? And that's a full circle for one leg. And then it's the same story that you need to have for the other leg, right? By the way, you see, when they were trying to put this doll in the position, what they did to make a picture. See, even this doll is showing you that the foot is easily rotating inwards. And when we judge the performance of the hip joint, how shall we measure it? We shall measure it not by the tests of like how much we can abduct and adduct the leg or whatever, right? We have to measure it by the combined action, right? So you see the foot, the hip joint enables the entire 180 degrees rotation one way, 180 degrees rotation the other way. So in that sense, the hip joint enables the entire circle. Now, how does it enable it? It enables it without any losses, right? Without any missed information. So that means that you can turn your leg all the way in, but you can stop at any moment, right? And then you can get your leg all the way out, and again, you can stop at any moment. But still, out of these four possible combinations, 1, 2, 3, 4. So it looks that the primary thing for us should be the individual rotation of the legs. In reality, not so much, right? The legs, they are linked to the same pelvis. Do you see the similarity between the position of the eyes in the orbits and the nasal bridge and the hip joints and the obturators? So the map of the pelvis and the map of the face, they are similar, right? So you see your eye sockets and your hip sockets, actually, they have the same name, right? Sockets. They perform in a similar fashion. But when it comes to our eyes, if I ask you the question, with the eyes, are we mono-eyed or are we binocular? We are binocular, right? So if a person shows you, like, you know, if a child has one eye floating or squinting, we call it a squint, right? like something is wrong if you become monocular instead of binocular. That's the same thing with the legs. To begin with, they're kind of bi-articular, right? So binocular, bi-articular. So you're bihipial if you want. So binocular actually means like bi-ocular if we put it directly, right? So two oculars, that's two eyes, and you are having this bi-ocular control. And then if we talk about the pelvis, you are bi-articular. Articular, right? So you see the word articular is for the joint. We'll call it a bihipial. So two hips, right? So you are bi-coxial, right? Bi-coxial means that you have two hip joints acting at once. So, and that's why the primary action is going to be the same as in being bi-ocular, right? So you have to be equally surprised with the person moving one leg more than the other rotationally, right? As you would be with the eyes. The person who can move one eye at will, we consider them freakish if you can just move your eyes, like as you wish, like make them float. So you can practice and get it, but that's not the primary control. And why I'm saying this, why we're always returning to the eyes, because the eyes are the most difficult muscles to control. You have 630 muscles around, right? There are 6 muscles per eye, right? Well, some people say 7. Okay, we will go with 7. So what does it mean? Those 7 plus 7, the 14 muscles which control the eye, they are the fastest muscles that you have in the body. The least delay. So in other words, the activation of the eye muscle could be as quick as 50 milliseconds. It's 1/20th of a second. So 20 blinks per second, that's what they're actually capable of. And if you ask yourself a question, where does the control start? The control starts from the eyes. So that's the ultimate test for your brain, because the faster is the muscle, the more difficult it is to control it with your brain, right? If we take a practical thing and say, what's the big difference between the basketball player who plays in the NBA versus a backdoor player, right? So the one who goes into the NBA can do the moves and dribbles with the delay of just like 1/5 of a second, 200 milliseconds. Whilst an average person would need twice as much, right? So it's just a double difference between, being able to do something with the ball in 1/5 of a second versus, 2/5 of a second, makes a difference between a professional basketball player and, literally a hobbyist from the back door. Now the eye is 4 times faster than even that. What does it mean for us? It means a very simple thing, that if the brain has a good enough capacity to control the eyes, it obviously has the capacity to control any other muscle of the body, right? So you see, so the control of those 14 muscles defines how well you can control the remaining 600 plus muscles. So if your brain is good enough to control the eyes, it's definitely good enough to control the legs. And if we see that for most difficult tasks, the brain operates in this bi-ocular scenario, so when it comes to the hip, it's also bi-articular, bi-hipial, bi-coxial action.